Hello, everyone. I'm Chicago Mayor Lori Lightfoot, and I am thrilled to congratulate Chicago Department of Public Health Commissioner Dr. Allison Arwardy, who is being honored today for her leadership on health equity. You could not have picked a better honoree. I truly can't thank Dr. Arwardy enough, nor can I think of anyone more deserving of this recognition. Dr. Arwardy was just 3 months into her role as commissioner when the once-in-a-generation pandemic hit. Still, she was knowledgeable and ready to lead our city through this crisis. And she did so by driving countless innovative and equitable initiatives to deliver better health outcomes to all of our residents. Dr. Arwardy mobilized every resource that we had at the local, county, and state and national level to help us develop a comprehensive COVID-19 response, leading with equity. And from the moment the COVID-19 vaccine arrived in our city, equity was our core strategy. With Dr. Arwardy's leadership, we prioritized resources for Chicagoans from less vaccinated but more heavily affected, under-resourced communities. Sometimes even literally making sure that we set aside vaccine to drive deep into these vulnerable areas in partnership with local leaders. From innovative outreach and incentive activities, Dr. Arwardy and the team at CDPH made sure that our residents were well informed and well protected. Thanks to that work, more than 70% of our city has received at least one dose of the vaccine, and our community of color didn't fall behind. Beyond the pandemic response, Dr. Arwardy makes equity a key pillar of CDPH's work through initiatives like the Healthy Chicago 2025 plan. The overarching goal of this plan is to reduce the city's racial life expectancy gap and to promote health equity across our city. I have no doubt that Dr. Arwardy saved countless numbers of lives through our COVID-19 response. And we will continue to save lives through our various health equity programs. Our entire city owes her a debt of gratitude for her outstanding leadership. So I want to thank and commend the YWCA for recognizing here today. And Allison, congratulations, you deserve it. Thank you.
Good afternoon. It is such an honor to accept the Outstanding Leader in Health Equity Award on behalf of the Chicago Department of Public Health. I'm so grateful to YWCA Metropolitan Chicago, and honestly to all of you who care about health equity in this room, for being strong and recognizing that equity is not the easy thing, but it is the way we must move forward as a city. It has been a crazy few years, these last few years. And while I'm proud of a lot of the work that we've done around COVID, and I'm proud of the way this city has come together, we still have such a long way to go, not just on COVID, but on turning a commitment to health equity and, importantly, racial equity into action. My team had a lot of opportunities to push me and the department during COVID to do exactly that. Mayor Lightfoot, from right in the very early days of COVID, pushed us to stand up as a whole city, the Racial Equity Rapid Response Team. How often do you think about racial equity and rapid response in the same sentence? I'm guessing not that often. But for me, it was helpful to think about this not just as a long-term plan, but as a choice that we make as a department, as a city, as organizations every day. That it's a choice that we have when we decide how to allocate resources, how to involve communities, how to recognize the ways in which we have done this poorly in the past. 2020 was not just the beginning of COVID, it was the year that CDPH released our 5-year plan, Healthy Chicago 2025. We had already made the decision prior to COVID to focus this on the racial life expectancy gap, where even prior to COVID, Black Chicagoans lived almost 10 years less long than other Chicagoans. That is unacceptable, that is preventable, and that is something we must shine a light on. I'm particularly pleased that YWCA of Metropolitan Chicago also called out the work that the department did in our data brief that came out in 2021, the State of Health for Blacks in Chicago. This, of course, was building on the work that came from Healthy Chicago 2025, but it was the first report that CDPH had put out that used Black Chicagoans as the reference group, with a very specific focus on all of the ways in which we as a city are not where we need to be when we think about the health of Black Chicagoans. I also want to note that the authors of this report were 5 Black women, CDPH employees at that time, all of whom brought different skill sets, but felt strongly that it was important for Black CDPH employees to be leading on this work. So I want to give a congratulations to our Health Equity Index Committee, Blair Akins, Dana Harper, Rochelle Paul Brutus, Donna Scrutchins, and Ya Simpson. These are just 2 examples of the ways in which my team has pushed me and all of us to think better every day about how we can focus not just on health equity, but on racial equity. I challenge all of you to do the same in your own work. It can be uncomfortable work. Doing equity well means saying no to people who sometimes are used to always being told yes. It means putting resources not just where it is easiest to put them, but where it is most important to put them. We're still learning every day at CDPH. I'm still learning how to lead and lift up other leaders in this space. But I so appreciate the YWCA of Metropolitan Chicago for recognizing this work. We have a long way to go, but with all of you working on this in whatever work you do, I know that we can make a difference. Thank you again for this award. Accepting on my behalf today is Sandy Brown. She is CDPH's Deputy Commissioner and our first Chief Racial Equity Officer. She joined the department in 2020. We had plans for her position prior to COVID, but really has come in at a time of unbelievable change for the department and for this city. Also here with her from CDPH is Megan Cunningham, our Managing Deputy Commissioner over Community Health. Her bureau puts together our strategic plans and works with a lot of the community organizations that I know are in the room today. So again, I'm sorry I couldn't be there in person, but thank you to Sandy Brown for representing on behalf of everybody at CDPH. This award really does belong to everybody working on these issues at my department. Thank you.